If you only watch one vitamin D video, make it this one, so you don't underdose or overdo it. I'm Pharmacist Phil. Education only, not personal medical advice. Let's start with the right blood test. Ask for the 25-hydroxyvitamin D test, also called 25-OH vitamin D. In the United States, it's reported in nanograms per milliliter. If you see international units, 1 nanogram per milliliter is about 2.5 nanomoles per liter. What target should you aim for? Many guidelines consider around 20 to 30 or more nanograms per milliliter sufficient for most people. Some clinicians aim for 30 or above in people at higher risk of low levels. Extremely low is often under 12. Your doctor may tailor a target based on your health and your risk. Who should consider testing? People with limited sun exposure, people with darker skin, older adults, people with higher body weight, anyone with malabsorption like celiac disease, inflammatory bowel disease, or after certain surgeries, and people taking medicines that affect vitamin D levels such as some seizure medicines, rifampin, or long-term steroids. Now dosing. For many healthy adults, a typical daily maintenance range is 600 to 2,000 international units of vitamin D3 per day. D3, cholecalciferol, is generally preferred over D2 for raising and maintaining levels. Take it with a meal that contains some fat to help absorption. Daily or weekly dosing tends to work better than sporadic megadoses. If your blood test shows you're low, your clinician may recommend a repletion plan. A common approach is 50,000 international units of vitamin D2 or D3 once weekly for 6 to 8 weeks, then retest and switch to a daily maintenance dose. Avoid massive once-a-year doses, which have been linked to worse outcomes in some older adults. How long until vitamin D levels change? Give it 8 to 12 weeks, then recheck if you were low or if your dose changed. After that, your maintenance dose keeps you in range. Safety matters. Do not exceed 4,000 international units per day long-term without medical supervision. Toxicity is rare and usually comes from very high chronic dosing or labeling errors, but it can cause high calcium levels. Symptoms can include nausea, constipation, confusion, or kidney problems. If anything feels off, stop and call your clinician. There are important interactions and conditions to know about. Medicines like orlistat, cholestyramine, some anti-seizure drugs such as phenytoin or carbamazepine, rifampin, and long-term glucocorticoids can lower vitamin D levels or interfere with absorption. Space vitamin D at least 2 hours away from bile acid sequestrants like cholestyramine. If you have kidney disease, high calcium, hyperparathyroidism, sarcoidosis, or another granulomatous disease, or if you're pregnant or breastfeeding, get personalized guidance before supplementing. People with higher body weight or malabsorption sometimes need higher doses to reach the same blood levels. Again, that's something to do with your clinician and follow-up testing. What about sun and food? Sunlight helps your skin make vitamin D, but balance that with skin protection and your skin cancer risk. Foods that contribute include fatty fish like salmon or sardines, fortified milk and plant milks, and fortified cereals. Most people still need some supplement to hit targets, especially in winter or with limited sun. How to choose a supplement? Look for vitamin D3, cholecalciferol, from a brand that uses third-party testing. Soft gels or liquid drops are easy to absorb. Check the label for the dose per serving so you're not doubling by accident. Keep it in a cool, dry place. How to take it perfectly? Pick a consistent time. Take your daily dose with your largest meal or set a weekly reminder if you and your clinician chose a weekly plan. If you miss a daily dose, it's fine to take it when you remember. Just don't stack multiple days into one huge catch-up dose. Quick recap. Test with 25-hydroxyvitamin D. Aim roughly for the 20 to 30 plus nanogram per milliliter range, unless your clinician sets a different target. Most adults do well with 600 to 2,000 international units of vitamin D3 daily with food. If you're low, consider a supervised repletion plan, then retest. Stay under 4,000 international units daily long-term unless your clinician advises otherwise. Watch for interactions and special conditions. If you found this helpful, watch my next video. Who benefits most when vitamin D levels are low? It explains where the strongest benefits actually show up and how to prioritize testing and dosing. Subscribe for more plain English, evidence-based guides. Education only, not personal medical advice.